Dr. Rajiv Sharma. Sorry for the wrong use of honorific on our invitation card. We have used Mr. instead of Doctor. Dr. Girish Narayan, Dr. Chandrasekhar, Sri Prasanna Bhandari, Kothari family, my colleagues on the trust, earlier donors of machines and facilities for our various centers, ladies and gentlemen. It gives me a great pleasure to welcome all of you at this inaugural function for our latest and unique dialysis center to provide facilities for patients of hepatitis B for whom there is no such facility in the twin cities of Hyderabad and Secunderabad. Medical science has made enormous progress in last few decades and helped increasing longevity of human beings. A large number of facilities, including the dialysis, is the gift of medical science to human beings. But a large number of these facilities are out of reach of common men. And therefore, in spite of these advances, common men are not able to make use of these facilities. It is in this context that 16 friends way back in 2009 joined together to find a solution to provide affordable dialysis service to people who cannot meet the expenses of commercial dialysis. And that's how Bhagwan Mahavir Jain Relief Foundation Trust was founded in 2009. Starting with 5 patients and 16 dialysis in a month, today we have more than 800 patients and we do close to 7,500 dialysis every month. We have so far done more than 2,60,000 dialysis since we started this program. Our first center started in collaboration with the government. We have been running another NGO in the same Kinkati hospital, and we were aware that there is a dilapidated building in that hospital which is being not properly used. And therefore, we approached the government to provide space in that hospital free of charge. The then Principal Secretary, Medical and Health, Dr. Ramesh, was very helpful, and he agreed to give us that facility on rent without rent for 5 years to start this center. And that's how our first center with 24 machines came in collaboration with the government of Andhra Pradesh. It is an outstanding example of cooperative effort in affordable healthcare between the government and one NGO. We are in the process of negotiating with the government to give additional space in that hospital. A government order has already been issued, and we will shortly expand the capacity of that center from 24 machines to maybe 36 or 38 machines. After our first venture in King Koti, we had 2 more ventures in collaboration with Mahavir Hospital, here with 24 machines, and with Raja Ramdev Memorial Hospital in Kukatpally, again with 24 machines. And with this 8 machine center, which was inaugurated today, we will have 34 machines in Mahavir Hospital itself. Perhaps we are the biggest dialysis service provider in the city of Secunderabad and Hyderabad. Our efforts are to ensure that nobody who needs dialysis has to embrace death prior to what is possible through human intervention. So the idea is every citizen of Twin Cities who needs dialysis and who cannot afford, we should be able to provide services to him. Our 2 great founder chairmen, Mr. Parakh Rtd and Mr. Dheeraj Bhai, had a dream of having 108 dialysis machines put up in Twin Cities as objective of this trust, and we are sure that before close of 2016, we will definitely have 108 machines in the facilities. In this endeavor, we have received unprecedented support from institutions and individuals with philanthropic minded people. It will not be possible to express my gratitude to all of them individually, but we couldn't have done this entire work without such grand support from all those donors who have volunteered to come and sponsor the centers and donate the machines. We have Kothari family here today who have sponsored the center here, and we have 8 donors who have donated 8 machines for this center. It is a privilege to share with you that we had never to go and request for donation from anybody. Every time we announced opening of a center, the donations have been coming up spontaneously without anybody going and making any request. I also expect that when we open our new centers, about which we are already in dialogue with institutions and individuals, we will get same spontaneous support, and we will carry on with this mission with support of all of you. Thank you very much.